We're delighted to have been invited into the North Sedgemoor Group Clinics, and right from the very beginning having a valued input into its design and now delivery. Having an active partnership involved in health focused clinics brings a completely different element to the offer. We work closely with people in their homes and local communities and bring a wealth of insight, experience and skills around finding what really matters to people, and then using movement as a tool to help them nudge towards healthier behaviours and better self-management.
The experience I've had with these clinics have just been phenomenal, because I knew the likes of SAS existed, but I've never actually directly worked with them. But in the flip side of it, from a functional point of view, the clinics for me mean that, you know, I can see probably 5 to 8 patients a day if I'm really busy. Whereas with these clinics, we can have, you know, 15 people, 12 to 15 people in the morning, 12 to 15 people in the afternoon, and I have the oversight of all 30 of those patients and can input into everything about them as an individualised care plan, which means we get to see far more patients.
With the third group that we've just completed today, just so lovely to see. They're really enthusiastic, really motivated. You can see they've come together, there's peer support there. You're bringing patients together with each other and members of staff, so that is a new way of working and that they don't miss out. So if someone can't come to a face-to-face, at least they can still have that peer support and that hour and a half in a group clinic.
Well, I think in a group setting, you've got the ability to talk to others and obviously see what problems they're also experiencing. And it helps you then assess your own problems.
It puts a personal face to the NHS and the care I've been receiving. And it's great to be able to have people who've had a similar journey I can chat to, but also the clinicians and the pharmacists I can discuss specific problems with. And that's been really helpful.
Well, I just think it's a really good thing for people with similar issues, i.e. heart failure, to meet together and discuss what they're all worried about.
You can sense as individuals a real energy, that's the sense. We also measure that, and we've been very deliberate from the outset, so we knew we've got a baseline, so we'll be able to evaluate that. And the other bit to reference is the actual team that are delivering this. So that is a new team from health, SAS, voluntary community sector, the hospital trust. We're just really keen to think about how can all of these different teams support people, families and carers.
Yeah, we've seen a really nice evolution of the group. Some people will immediately gel when they meet and find people that they have something in common with, and other members of the group it's taken a little bit longer. As a group, they get a much longer time with support than they would if they were going in for a one-to-one appointment. And while some of that time is focused on other people, they're learning from the conversations that other people are having. I think this is a really important way of working. It gives really good value for both the healthcare system and for the participants. We've had people in their third session coming back and saying, can we do this on an annual basis? This could be their annual checkup.
We've discussed with the group, we want them to find their own solutions. So we've connected them with the marketplace into the resources that are happening in the community. We want to continue the project and bring in another group of people. So we build momentum, and I think it's up for our neighbourhood, our community to design where this goes.